I'm Dr. Brian Smith. I'm a physician here at CSMO, hand and upper extremity specialist. I've been doing this for almost 23 years, I think. I did my schooling at Indiana University Med School, and then went to Syracuse for my orthopedic training, and then I did a hand fellowship at the Mayo Clinic in Minnesota. I practiced in a multi-specialty group in Florida for about 6 years before I came here about 12 years ago for the Center for Sports Medicine. They recruited me to come up, so I've been very happy I've come up. I've enjoyed every bit of it. I have married and live on Lookout Mountain, have 5 wonderful kids, anywhere from 21 to 14. Probably the reason I became a doctor is that when I grew up, I had real crooked teeth, and I wanted to be a dentist, orthodontist. I hated working in people's mouths, and so I said, what else can I do? So I went back and went to med school and really enjoyed working in an anatomy lab and the intricacy of the hand. So I thought that was fascinating. So I ended up going to a residency that had a real strong hand program, and had the president of the Hand Society there who did his training at Mayo Clinic, and he encouraged me to go into hand, and that's when I went to the Mayo Clinic, and I love the meticulousness of doing the hand, the intricacy of it, and so I still love it, and I love to have people, not be able to do something and then restore them back to doing whatever they want to do. See, really, it's quite variable. It's anywhere from the elbow on down to the hand, anything, whether it be arthritis, an injury, some deformity you've had your whole life, something that develops like numbness and tingling in the hands, popping or locking of the fingers, fractures, ligaments that are torn, even people who have cut off a finger and have to reattach it. And I have the ability to do that if need be, although that's extremely rare. So basically anything that below the elbow I see and treat. My favorite thing about being a doctor is essentially being able to restore people back to what they want to do, educate them about their problem. Doctor is another definition of it is teacher, and so I've always taken that to heart, is to educate a person no matter what kind of schooling they have, so they can understand their injury in their own terms. If somebody asks, what do you do with your spare time? Boy, there's just not a lot of spare time, but I condense as much as I can into the short time we have. There's always stuff to do with our kids, whether it be fly fishing with my son who likes that, or going to work out with them in the gym. My wife and I like to do that together, and we get our kids to do it with us. We like to snow ski. My wife just learned to snow ski this past year, and she also she learned to ski with a broken rib, which we thought was pretty neat. And then she loved fly fishing in Yellowstone so much that we ended up getting her own fly rod for Christmas. So those are the things that we like to do. In addition to all of us love hockey, so we love the Nashville Predators. We try to go to their home games. At one time I was a full season ticket holder. I don't have time to do that anymore, but we watch the games and talk about it and have friends that are involved in it. So I'll say those are our passions right there. Everything in orthopedics is covered, and we have subspecialists in every part of the body that you may injure. And these people are the latest trained and have the most insight and are the best in these areas. All of them have been fellowship trained in a certain area. That's why I just practice an elbow on down, because I have people that do wonderful shoulders and hips and knees, and I don't have any business trying to do that because they are so good at it. And why spread myself too thin and try to do everything? I concentrate on what I do best, and they do what they do best, and I'll gladly send them a patient that has a shoulder problem that I discover that comes in the office, or a previous patient, and get them set up, because I know I'd want my shoulder treated by them or my knee treated by them. And so it's great to have partners that you can respect and that you think do excellent quality work and be proud of.